So for neuro, again, you have your central nervous system, your peripheral nervous system, okay, your meninges, spinal cord, cervical, thoracic, lumbar, sacral, okay. All of your dermatomes, you guys have seen the dermatome map several times now, okay. Cranial nerves, 1 through 12, okay. This is just a review for you guys. Probably not even gonna go through all of this, okay. So headache in kids sometimes can be precipitated sometimes by visual things. So that's the first thing to do is check their eyes, send them to ophtho, see if they need glasses from straining, okay? Sometimes this can be migraine if they have the aura, okay, visual changes, speech, the numbness, tingling, okay? Tension headaches, and then cluster, more rare in kids. That's when they have more like draining of the nose, draining of the eye on one side, okay? Secondary headaches, okay? This is more serious, especially if it was associated with a traumatic injury, okay? Make sure on physical exam, if there's neurological findings, they may need an MRI, okay? So if they have neurological deficits, okay, they may need an MRI. Remember, MRIs are safer in kids than CAT scans because it's not radiation, okay? Again, migraines again. Things that can bring on migraines, precipitating factors in children include adolescence, periods, hormones, dehydration, okay? Poor sleep, stress, and caffeine, especially in the adolescent, okay? Sometimes they are associated with nausea and vomiting, sensitivity to light, okay, which we call photophobia, and vertigo, which is the dizziness, okay? Just like anything, headaches do have this pre-headache state called the prodromal, okay? Then the actual headache, and then the postdromal, which is where you have like a headache hangover, I like to call it, okay? You feel a little just out of it still, okay? Tension headache, a lot of times related to stress, okay? Sensitivity to light, sound, poor posture, okay? Carrying heavy backpacks, doing a lot of work, things like that, okay? All right, we do not do screening typically, but we will ask questionnaires, okay? See if this is associated to anything else. Can they engage in their normal activities? Okay, is this impacting their normal activities? Okay, treatments, again, over the counter in kids, Tylenol, Motrin. Hydration is so huge, so we do try to encourage that, and rest as well. Then we will go into some different headache cocktails and medications, okay? You guys know triptans, ergots, all of those things. Caffeine is also can be a trigger and a treatment, okay? Let me see, self-care is appropriate, okay? Birth control can also cause headaches, okay? So that's another thing to evaluate and ask for. Screen time, okay? Exercise, the amount of exercise, are they getting enough, okay? Getting outside. All right, moving right along. Head injury, okay? You guys know your pia mater, your arachnoid, your dura, and your skull, okay? And where the injury could occur, okay? If it's subdural or subarachnoid space, okay? You guys remember the coup and contra coup injuries, okay? Coup is when you hit the front. Contra coup is when you have injury to the back because the brain shifting back and hitting the back of the skull. Okay, you can have hematoma formation inside. What is the biggest thing that we're going to be screening and evaluating and assessing as nurses?
The level of contraception. The
GCS,
yeah.
Yep. So the GCS, yep. And then for little kids, we're looking for abuse. If it's this shaken baby syndrome, okay, where they've shaken the baby causing head injury, okay? Remember TBIs, traumatic brain injuries, okay? High mortality, males more often, okay? Physical abuse, high risk activities, sports, okay? These kids have larger heads, weaker neck muscles, okay? Higher incidence of falls. Again, with the TBI comes the concussion screening and all of that type of stuff. When you go back to sports, when you go back to school, usually when your neurological symptoms have improved, your headache has improved, okay? Usually 48-hour rule for concussions, okay? They usually cannot return to school for about 48 hours of rest with no driving, no electronics, okay? No reading, no schoolwork, literally brain rest, okay? Sports might be additional clearance if they still are having headache or any other neurological symptoms like dizziness, severe fatigue, blurred vision, okay? Over-the-counter medicines, including NSAIDs, because we don't want to mask any other symptoms by giving them narcotics or any other medications like that. Again, you guys know if there's anything else going on, we worry about the ICP. So if there's bleeding or anything like that, ICP over 20 start to increase and we need treatment of that. All right, again, safety, prevention when riding in a car. Don't get in a car with somebody who's drinking. Seat belts, don't sit in the front seat. Nowadays, it's like age 13 and below needs to sit in the back seat, okay, for their neck muscles, okay? MRI if symptoms still go on. Infection, encephalitis can be due to mosquitoes. Remember that, okay? Sometimes can be viral, sometimes can be parasitic. Remember we talked about the amoebas in the lakes, okay? All right, inflammation, this is cause headache, confusion, hallucinations, seizures, okay? Fever, rash, all of those things. They may have a bulging fontanelle, so their ICP could be higher. Again, how are we going to diagnose this? Lumbar puncture is how you're going to decide if the CSF is infected, okay? Obviously imaging to see if there's swelling in the brain. They're going to need corticosteroids. What other type of medication decreases swelling in the brain? Close.
Is that osmotic?
Osmotic. So what's the name of it?
Fentanyl, is it?
Mannitol. Yeah, I thought you said atenolol. Yeah, mannitol. Mannitol, osmotic diuretic. Very good. All right, and then they might end up on antiviral therapy for encephalitis, okay? Supportive treatment, okay? Rabies, if you didn't know it, it can also cause inflammation of the brain, leading to nervous system failure. This is why we don't want anybody in the U.S. to get rabies, okay? There's not human-to-human transmission. You guys know it's from animals or something infected and biting us, usually bats, raccoons, okay, things like that, okay? Usually it's a feral animal, okay, usually not a pet, okay? Non-vaccinated. This is why we need to teach children to stay away from feral animals, okay? Wound care right away, okay, clean it right away. Post-exposure prophylaxis, which is the immunization and the immunoglobulin, okay? All right. Remember, there's no true test for it. You can only tell truly on autopsy if they had rabies or not, okay? And then animal control gets involved. They do all of that. They assess where it was, what type of bite, how severe the bite was, if they can quarantine the animal or not, if the animal has symptoms or not, okay?
You said there's no test to test for rabies?
Like if you got bit by a rat, there's not like I can draw a rabies level on you.
Yeah, how do they know that people have rabies then?
On autopsy, they'll do, it's on like the CSF in the brain and all of that. So they can't, and that's why they have to put down the dogs to truly tell. So they try to quarantine them first, okay? All right, febrile seizures. Okay, we've seen some of this in clinical, okay? This is a sudden rise in body temperature that causes seizures, okay? You have simple and then you can have complex. Simple febrile seizures are most common, okay, and affect the whole body, while complex seizures are focal and can have one part of the body affected, okay, like their arm could be twitching, okay? Usually this is younger than age 5 with the highest incidence around age 2, okay? And for teaching, if they've had a febrile seizure, there's a 40% chance they will have another, okay? All right, this does not mean that they're going to have seizure disorder, okay? Usually this is related to a viral illness or bacterial illness of some sort, okay? So we treat the fever, we find the cause, okay? Fluids, all the other things. Sometimes they do need seizure medications in the case that we saw, okay? Again, look for the fever source, lab results, if it's a nasal swab, COVID, flu, RSV, chest x-ray, looking for pneumonia, UTI, all of those things, okay? So treat the cause, okay? To actual epilepsy, okay? If the seizure occurs when electrical activity in the brain is unexpected and uncontrolled, so it's just firing, rapid firing, okay? Usually this is diagnosed, let's see what the criteria, believe they have to have 2 non-febrile seizures, okay? And then they'll go and they'll get an EEG, which you can see her with the, where's it at? The cap on right here, okay? A lot of these seizures are idiopathic, meaning we do not know the entire cause, okay? So we can get an imaging of the MRI to make sure there's no structural defects, there's no masses, anything like that, okay? Sometimes dietary changes can do it, okay? It has been shown that seizure patients will do better on a ketogenic type diet, okay? So less sugar, less carbs. They can also do a vagal nerve stimulator, okay? It has electrical pulses that stimulates the vagus nerve. Apparently that's a proven treatment. It's can be used for children older than 4 years old. Okay, they can also do electrodes implanted into the brain that provide intermittent stimulation, and it's kind of similar to the vagal nerve stimulator, but it's just a little pulsation in the brain. Again, those are other types of treatment out there. We also have anti-epileptics, which we know. Most common one nowadays is Keppra for kids. Again, for seizures, this is going to be a lot of education on the family, okay? It can cause learning disruptions. It can cause social issues for the kids and their personal development, okay? Afraid to go sleep over at somebody's house, afraid to drive, all of those types of things, okay? So supporting them, helping them remain seizure-free, okay? Avoiding triggers. If they know it always happens when they're on their period, then to stay hydrated and to maybe take vitamins while they're on their period, all of those things, okay? Some kids get sleepy because of their medication, so they might forget to take it or not want to take it, okay? Then that lowers their seizure threshold, okay? There's other antibiotics and other meds that we can give kids, and it also lowers their seizure threshold, and they're more likely to have a seizure, okay? AVM, we talked about in adult too, so I'm gonna skip over that. Hydrocephalus, okay, that is extra fluid, okay, enlarged ventricles of the brain with increased pressure from too much CSF being built up, okay. A lot of the times for screening, it's if their head circumference is measuring larger, it's off the charts, okay, then they need to go get ultrasound or MRI on the brain and find out what's going on, okay. There is a genetic link, okay. A lot of times they will end up with a shunt. The shunt goes from their brain and it takes the fluid into their peritoneal cavity and dumps it there for it to be absorbed, okay. They can have symptoms of ICP, confusion, vomiting, headache, okay, seizures, all right, difficulty staying awake, difficulty with their gait, walking, okay. So again, our goal is to decrease that fluid in the brain, okay, and that is usually due to a shunt, okay. It can be fatal if we do not treat this, again, because the swelling, the brain tissue will then become affected by it. Okay, so families need to be aware of things if the shunt is malfunctioning. So they need to know about neurological symptoms to look for, you know, repetitive vomiting, complaints of headaches, visual disturbances, okay? They'll usually be followed by neuro and have shunt evaluations every 6 months to every year, okay? Okay. Spina bifida, we've talked about in OB, okay? You can have spina bifida occulta where there's no symptoms, okay? Then you can have all the way to where you have the whole bundle of nerves and spinal cord outside of the body that needs surgical repair, okay? So remember, depending on the severity can depend on if there's weakness, numbness to the lower extremities, okay? If they have loss of bladder or bowel control. Remember, a lot of this is due to folic acid in those first 4 to 6 weeks, and that's when a lot of females don't even know they're pregnant, okay? So these kids, if it's severe, maybe in a wheelchair, if there was dysfunction and they weren't able to repair it in surgery at birth, okay? So the support groups, being able to connect them with people of like-minded, okay? All right, tetanus. We've talked about tetanus a lot, but again, this is due to the bacteria, Clostridium tetani. Okay, it affects the nervous system. It can cause paralysis and spasms. Okay, so if you have some type of injury that has dirt contamination, because this is found in the dirt, animal feces, warm climates, and the soil. Okay, if it gets into a wound, then these spores can grow and cause tetanus, okay? Again, we over-vaccinate, it seems like these days, for tetanus, so seeing it clinically is very rare. Let me see if you guys have a picture in here. No. But they will have definitely spasms. They say call it lockjaw back in the day because it would cause your jaw to be kind of locked up like that. Let's see, muscle spasms, the face, neck, and then difficulty swallowing, okay? Because remember our diaphragm, okay? Incubation period is 4 days to months. So that's why getting that tetanus shot within the first 72 hours is kind of what our recommendation is, okay? All right, cleaning the wound, providing the tetanus, antibiotics if needed, okay? All right, so tetanus is a bacteria, it lives in the dirt, okay? Muscle rigidity, spasms, and respiratory symptoms, okay? Right, botulism, another one. Where can kids be exposed to botulism? Anybody know?
Is it honey?
It's honey. Yes, that's why we do not give honey in less than 1-year-old kids. Okay, because of this, just like Botox in your face or anywhere else, it blocks the nerve ending and the nerve signal. Okay, causes weakness in facial, eye, and mouth muscles. Okay, so their head, they can look floppy. They can't control their head. Okay, difficulty swallowing. Okay. So these are usually foodborne, okay, where there's contamination, okay, with botulism. They reproduce, then colonize, and then they can you can be exposed to them through your GI tract, okay? Remember, between age 3 and 4 months, they're just still developing that gut microbiome. Remember, they're pretty much come out sterile. They don't have bacteria in their gut. So they're unable to fight off some of these if it's a severe bacteria. Okay. Okay. Hispanic cultures have a higher incidence of botulism because they do typically use honey and raw honey as herbal medicines. So that's something to do a teaching on. Okay. Like you can use it, but you need to wait till over a year old when the gut has enough bacteria to break down that honey. That's the pathology behind it. Okay. So they can do a culture and a toxin assay from stool or serum or even gastric cultures. Okay. So there is a botulism antitoxin, okay, that can be given to help with the recovery. Again, this can be life-threatening because it can affect the respiratory muscles as well. Hand hygiene when you're changing diapers, because again, GI tract, like we said. So if you did have some type of case or case study about botulism in infants, hand hygiene, throwing out the diapers, washing good, all of that, okay? All right, drowning. Again, in Florida, we see this. So water temperature can affect this as well. So hypothermia starts to develop pretty quickly, especially in cooler areas, okay? It slows your heart rate down to become bradycardic, okay? Usually about 2 minutes that you can't hold your breath any longer, okay? So then you start to gasp and you start to inhale water, okay? All right, again, this is why we need pool fences, pool cages, doors to the pool, okay? Third most common injury related to death in children. Most common aged 1 to 4. More common in males than females. Okay. Again, if they come in, we need a chest x-ray, maybe an ABG. Okay, they're gonna probably be acidotic. They're probably gonna be hypoglycemic because remember we used up those stores of glucose, okay? Again, parents, family members, PTSD, okay, related to this, even if it was a near drowning. This is why teaching kids to swim at an early age is so important if there's water around, okay? All right, spinal cord injuries. Okay, remember incomplete is a partial loss of signal. Complete, there's no signal transmission, so that could be paraplegic, quadriplegic, wherever the injury is, okay? This could be after blunt trauma, like vehicle accidents, sports, falls, okay? Adolescents have a higher risk because of their likelihood to do activities that are dangerous. All right, sometimes there's surgical intervention that can be performed, but a lot of times if it's completely severed, we're not going to have any recuperation, okay? So they might need differences, and this is where OTA comes in to help them eat, feed, draw, talk, all the things that they may have lost, okay? If you can't use your hands or you have difficulty using your hands or legs, okay? And then a little bit of review on cancer, gliomas, okay? Let's see here. Imaging of the brain, where you can have a mass, okay? Let me see what else there's different areas that they can be. Medulloblastoma, okay? That's an embryonal brain tumor, fast growing. I'm not going to go over specifically about this, but just know that there are different types of these. A neuroblastoma is a solid cancerous tumor originating from embryonic nerve cells, okay? Seen under children under 5, okay? They might also have skin lesions, okay? It's kind of rare, so. All right, let's see. We do know that cancer is leading mortality among children, okay? That medulloblastoma, 85% 5-year survival rate, so pretty good because they have surgical, okay? Neuroblastoma, 82% survival rate after surgery, so pretty good survival rates with surgery, okay? All right, that's pretty much it for neuro, okay? So I would, for the brain cancers, I would educate them that a lot of them are surgical, okay? For musculoskeletal, okay? A lot of this is a review too, so I'm gonna keep on rolling, okay? And pick out anything that might be pertinent to you guys. All right, contusion is a bruise, okay? Kids can get them all the time. Ice, okay? Ice, rest, elevate, you're gonna see that a lot. dislocation, okay? Do you guys know what a dislocation is? It's when the joint is disrupted, okay? Usually there can be ligament damage and you need to put the joint back into its proper alignment. That's called a reduction, okay? If that's the elbow, the shoulder, the knee, whatever, okay? Very common with sports and injuries, okay? Ice, elevate, immobilize, okay? And then surgery at some times, okay, if you have to pin it, okay? All right, let's see how far we are at. Again, so when you're assessing for dislocation, if you're on the field and somebody has a dislocation, pulse, motor, and sensation. So do they have a pulse distal to the dislocation? Can they feel you? Okay. Can they move? Okay. If they can't, okay, there's probably, when you dislocate something, the nerves are stretched. Okay. So they might not be able to feel you. Okay. Documentation is key on that. Okay. Sprains is ligament damage. Okay. Rest, ice, compression and elevation. Okay. Let's see here. Strains, again, tendon injury. T for tendon. Okay. Or muscle injury. Okay. Again, a lot of times we can't see this on x-ray, so they need the MRI or CAT scan. Those are soft tissue injuries. Okay. Soft tissue injuries. Immobilization, so that's actually the P. If you put a P before rice, it becomes price. So protection / immobilization, okay? Okay. Staying off of it, that also can be under the P, so using crutches, okay? Overuse, let me see where this is. We'll talk a little bit about this one. Overuse injuries, especially in the knees, okay? Osgood-Schlatter is very common in kids with the overuse syndrome. We can see that growth plate is right here. That's where the tendon attaches. They get this kind of almost like a tendonitis that hurts all the time right there, okay? Osgood-Schlatter. So sometimes on x-rays you can see some calcification around that, okay? And it just becomes inflamed, okay? So rest, ice, elevation. If they play basketball all the time, they might have to limit that, okay? It's very frustrating because it's usually in very athletic types of kids that we see this. So we say like, hey, you're not allowed to jump anymore, and they're a basketball player. It kind of sucks, okay? You're not allowed to run anymore. Well, you're a football player, okay, or a soccer player. So it kind of stings for them. So sometimes finding alternative sports, okay? Let's see. NSAIDs, self-care. Let's see. All right, mobilization, okay? If you do work in the ER or you do work somewhere where you're in ortho, you'll learn different types of splints, okay? However, we do know crutches. You need the 2-finger rule, but put your 2 fingers under the armpits. That's where the top of the crutches should then be, okay? They shouldn't be all the way flush into the armpit. 2 fingers, okay? Then you need to have them put the crutches out first and then kind of swing through, okay? They don't need to be putting weight on a fracture or anything like that. All right, speaking of fractures, here we go, okay? A fracture is a break. Some parents don't understand that. They're like, oh, they just fractured it, they didn't break it. No, a fracture means a broken bone, okay? You can have a complete fracture where it's cut in half, incomplete where it's kind of broken, or like a green stick where it kind of bends, okay? And that's kind of like what we have here, okay? You can have different areas of fractures. So here's a buckle fracture. It's kind of like if you think of falling down on your radius and ulna, it kind of buckles, if you will. Okay. Closed fracture versus open fracture. If it punctures through your skin, it's an open fracture. Okay. Very complicated means multiple bone fragments. Okay. Usually that's surgical. Okay. These are different things. If you're going to work in ortho, you'll learn all these different types. Okay. Again, green stick is very common in kids because it'll bend and it might crack, but it doesn't break all the way through, okay? We still splint it because it needs to heal, okay? Again, sometimes in kids, we might not see it on x-ray. We may just see subtle findings, okay? So sometimes they do need a CAT scan, x-ray, things like that. We still splint it if they're swollen until the swelling goes down. They can get further follow-up, okay? So casts, splints, boots, okay? Sometimes they'll need a pen in there. Okay. Let's see what else. Again, so anytime they're in a splint, if they're in the hospital, you need to check what we call the PMS, pulse motor sensation, distal, okay? Can you feel your toes? Do I have a pulse? Is there good cap refill? Okay, so positive PMS, pulse motor sensation. Open fractures are at risk for what? Infection. Okay, so those patients are going to be on usually a dose of IV antibiotics right away, and then they're taken to the OR to fix it, okay? So speaking of infection, we'll talk about osteomyelitis, okay? Most common bacteria, you see it, is Staph aureus, which we have on our hands, okay? So if we have an injury and we take that staph and put it down deep, okay, then you can have infection of the bone, okay? All right, when you do x-ray of the bone, you can see this type of infection in the bone. Sometimes they can have gas or air bubbles, okay, with certain bacteria. A lot of times this will need IV antibiotics, okay, or surgical intervention like removing toes or removing whatever is the area involved, okay. Frequent follow-up, wound care, home health nurse, because they might go home on PICC line antibiotics for several weeks. Okay, especially if this is like a poorly controlled, say a type 1 diabetic, doesn't want to take their meds because they're 16 and they're trying to be cool and do all the things and their sugar lives at 600 all the time. They're not going to heal very well, okay? All right. All right, torticollis is something you might see in babies, okay? But it is a condition where the neck looks twisted. Sometimes there can be congenital at birth where he kind of comes out like this. It's because of shortened sternocleidomastoid, okay? But a lot of times it can be from accidental dislocation of C1, C2. That is acquired torticollis, okay? And it can compress the nerves in C1, C2, okay? Sometimes it's literally just a spasm of the sternocleidomastoid, okay? And then it can be supportive care, muscle relaxers, things like that, okay? You can't have trauma at birth that can relate or can cause this, okay? All right, they can have chronic torticollis that happens, okay? All right, again, range of motion of the neck when they're doing their newborn assessment, okay? Sometimes there can be surgery that needs to be done, especially if it's that they're born with it, okay? Or if there was something else in the neck that caused it. Again, physical therapy, muscle relaxers, different types of interventions, okay? All right, moving on. All right, spinal curvature. Okay, so this right over here is known as kyphosis. When you're pregnant and you walk like this and that's lordosis, okay? That's the spine going inward. And then scoliosis is when it's sideways, okay? We usually start screening for this in middle school. And then if it's severe, we refer them out to ortho, okay? So scoliosis is the S. Kyphosis is like when you're pregnant and you're holding your back, okay? Lordosis is the old grannies, okay, that are all curved over, okay? All right, so poor posture, slouching, and then scoliosis is genetic, okay? Sometimes we can do bracing. There are different like genetic disorders that can cause an early kyphosis in kids, okay? So that they will need x-rays to figure out what's going on, see if there's any surgical. They can put pins and rods throughout the entire spine. A lot of times for scoliosis, if it's greater than 20%, they'll put them in a brace, okay? And they need to pretty much wear that brace all the time, okay? Trying to see what else that they say. Teaching them about their posture, self-care, promote good lifestyles, good body mechanics so they don't have chronic back pain, because it is kind of a chronic back pain because those muscles are always tight from being twisted, okay? See what okay. Dysplasia of the hip. This is something that you might see in that Pavlov's harness, okay? Pavlov's, whatever it is, harness. So this is abnormal development of the acetabulum, which is the portion right here of the hip. You can see it's kind of like subluxed out, okay? This is why we do those. Remember when we put their legs up like this and when we were checking to see if their knees were at the same thing, and then we took the baby's hips and we went like this to see for any clicking or popping? That's what we're looking for, okay? So breech positioning can put them at risk for this, okay? Females are more likely, okay? If you have twins or triplets, that's more likely because however they were in utero, okay? All right, so the ortolani was when we went like this, okay? The movement. Let's see what else we have here. We talked about in females, toddlers. So a lot of times they will end up with an, Pavlik harness. And then I think we have it on the next page. And sometimes surgery, okay? So that's what it looks like. It's to keep them in that abduction, okay? And so it doesn't pop in and out for those infants while they're waiting for surgery, okay? Let's see. So again, this is a surgical repair, and then usually they're casted afterwards, and it's a very hard cast to be in because obviously people have to go to the bathroom, but they have to keep them in that position. So keeping the kid clean, dry, keeping the cast dry, all of that can be hard, okay? Developmental dysplasia of the hip. Let's see if there's anything else. Okay, orthotics. So things with the feet, okay? Flat feet, okay? Sometimes can be an issue with kids, okay? Sometimes they will need different orthotics. There also could be maybe short tendons, and maybe they need their tendons surgically repaired. So they might be put in a device similar to this, okay? All right, leg calf Perthes disease. Interruption of blood supply to the femoral head, which leads to bone tissue necrosis, okay? So again, the exact cause is not really known, okay, but it has damage to the blood vessels in that area, okay? This will have decreased range of motion of the hip, painful movement of the hip, pain with walking, might atrophy their muscles and their glutes, okay? And then chronic pain and surgical treatment, usually if the child is over 8 years old, okay? I'm trying to skip ahead. Here is another congenital foot. Right here, club foot, okay? Deformity present at birth, okay? Shortened tendons, which cause the foot to be turned, okay? Higher likelihood in males. A lot of times this is surgical repair, okay? Where they or they can do several casting to try to get it back, but if the casting is unsuccessful, then they will do surgery, okay? I think that's probably about all you guys got to know about that. Osteogenesis imperfecta, that's kind of, this is fragile bones where they just break bones all of the time, okay? This is rare, so I'm not really gonna get into it. It'll be rare that you see that patient unless you are working in peds, okay? All right, JRA, well, this is juvenile idiopathic arthritis, which you might see, and again, autoimmune, we don't understand the reason why, okay? And environmental factors, but the same thing, swollen joints, may have fever, pain with joints, pain with walking, okay? The treatment involves steroids and DMARDs, just like methotrexate, like we talked about with rheumatoid arthritis, okay? Lupus in kids, we've talked about, pretty similar. That's the butterfly rash. That's a systemic lupus with the butterfly rash on the face, okay? Again, the A&A can open the the box for testing for that. Okay, autoimmune testing. Remember, earlier they're diagnosed, harder because it's not good on your kidneys. So if they're diagnosed as a child, that's definitely harder. Okay. More cancer. This is probably bone cancer, osteosarcoma, Ewing sarcoma, and let's see, rhabdomyosarcoma. Let's see if there's what I want to point out here. All right, x-rays, CAT scans, okay? This just shows you most frequently is osteosarcoma, okay? They will go in and take out the mass that is in the bone, okay? Again, sometimes radiation, chemo, things like that. Here you go. This is just saying on different amputations that they will, if is needed, okay? This is kind of getting way too deep here. All right, there's different below the knee, above the knee amputations, okay? BKA, AKA, okay? Different devices, cerebral palsy. We've talked about their tone before. We talked about cerebral palsy, how sometimes they can be floppy, sometimes they can be like very spastic. Okay, they can have atrophy. We've talked about muscular dystrophy before. All right, that is it for that.